Great. And so you talked about a Part B penalty, but there's also something with Part D plans that they may get a penalty for Part D plans if they don't sign up for those. Can you talk about that a little bit?
And we see that, unfortunately, all too often. Thanks for asking me that. So Part D, as our listeners know, is for drug coverage, okay? And there are really two ways to get drug coverage when you go on Medicare. You can, if you're on a Medicare supplement, you buy a standalone Part D or prescription drug plan, or if you're joining a Medicare Advantage plan, you want to make sure that you're joining a Medicare Advantage plan with prescription drugs if you don't have other drug coverage like through the VA, right? All too often we see people say, oh, I don't take any prescription drugs, or I only take generics. I don't want prescription drug coverage because it's going to add to my costs. Well, first of all, it's very minimal expense to add prescription drug coverage. And secondly, you do want to add it, okay? Kind of like the Part B penalty we mentioned. If you avoid Part D coverage, or if you delay it and you join later because you get some sort of chronic disease like heart disease, diabetes, cancer, God forbid, whatever it is, and you want to join a Part D plan, or you want to add prescription drug coverage in a Medicare Advantage plan, you're going to pay a Part D penalty for the rest of your life.
And you said something about the premiums, that it can be very affordable. And there are a wide range of Part D plans, right? And that's part of what we can help people navigate, is that depending on the prescriptions that the individual takes, there are different choices that those clients can.
I couldn't say it any better. That's right. Couldn't say it any better. But we will take their prescription drugs. We will use, we think the best source is Medicare.gov. We'll punch them in, and then we'll determine what plan makes the best sense for them, whether it's a Part D plan or a Medicare Advantage plan, based on the prescription drugs that they take.